Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This lecture is immunology lecture about transplantation immunology. Organ transplantation is done for physiological restoration of the organ and to a lesser extent anatomical restoration. Such as kidney transplantation. For transplantation to be successful, the MHC of the donor and that of the recipient should be compatible. Compatibility is determined by a test known as tissue typing. It is a laboratory test that tests for MHC or HLA. The types of grafts immunologically, the first one autograph, and this is graph between different sites of the same person. So from one site to another site in the same organ, and here the compatibility is almost complete. The second one is isograft, and this is graft between people of the same genetic makeup, like the identical twins. Also, the compatibility is high, but it still is not as the autograph. Allograft, this is graph between people of different genetic makeup, and the compatibility is lesser than the above. Xenograph, this is graph between humans and animals, that is say different species, and the compatibility may vary. The source of graft, from where are you going to take the organ to be transplanted? Maybe from a living donor, like people who donate their kidneys or other organs, or from a cadaver, a dead person. As I said, for successful transplantation, we need compatible blood groups and compatible tissue type by the tissue typing test for MHC, use of immunosuppressive therapy to lower the immunity, and induction of immune tolerance for the immune system is induced to accept the foreign antigens of the transplant. But in spite of all the precautions that are taken, complications may arise, leading to complications of transplantation. Number one, graft rejection. Here, the recipient rejects the graft, like a person with transplanted kidney, and the recipient rejects this kidney or any other organ. Number two, graft versus host disease. In this, the graft rejects the recipient. And here, usually the recipient is severely immunosuppressed, like those who have bone marrow transplantation. So the graft versus host disease is quite common among bone marrow transplant patients. Rejection, clinical types of rejection, hyperacute rejection. This occurs very early, even during operation, minutes to hours, due to pre-existing antibodies to donor antigen. Number two, acute rejection. This takes place from 10 to 30 days. That is to say, the time needed for development of acquired immunity. Chronic rejection, this takes a long time, from months to years, and due to the dual effect of the humoral and cell-mediated immunity, and there will be gradual and progressive deterioration of the transplanted organs, and this is common in the solid organs. It is a function, it is a feature of the transplanted solid organs. And this short talk is about this topic, important topic. I hope that it is understandable, and I wish you all the best.